Thanks for attending this health awareness series. We're glad you're here. If you're tuning in during a live event, please know that healthcare professionals will be available after the presentation to answer your questions. In the future, you can find a recording of this presentation on the Highmark Health Options website, just in case you want to refer to this information or share it with someone you love. At the end of the presentation, we'll share information about some Highmark Health Options programs that may be of interest to you. Presenting today is Donna Lanier, Senior Analyst, Clinical Quality Management. Welcome, Donna. Thanks for coming.
Well, thank you for having me today. I'm excited to talk about today's topic. So it's just important to note at first that it's important to remember your rights when you or another Health Options member is in the care of a paid caregiver. So today we're going to talk about critical incidents, which is a really important topic. Critical incidents are wrong actions that happen when a member is in the care of others, such as a paid caregiver or a parent. A critical incident could happen to you or another Health Options member. Children, older adults, and people with disabilities are particularly vulnerable. So today we're here to talk about why it's important to know what a critical incident is and how you can report a critical incident. So let's talk about who is a caregiver. A caregiver can be a parent who is taking care of a child. It can also be a paid caregiver, such as a person who is paid to help a person who is paid to help with care at home or a nursing home or hospital staff. When you or someone you care about has a caregiver, watch for any signs of abuse or neglect. So what is a critical incident? Most critical incidents involve suspected abuse or neglect. Other critical incidents involve theft, injury, or even death. And we'll go more into detail about the different categories of a critical incident. A critical incident is when a caregiver is suspected of abusing someone physically, mentally, or sexually, neglecting someone, stealing or causing financial harm, causing severe injury, acting inappropriately or unprofessionally, refusing to do their job. Another critical incident is an unexpected death. So next we're going to talk about what is an unexpected death. The most serious critical incident is an unexpected death. An unexpected death is when someone is found deceased in their home. Someone dies after a sudden illness or injury. This includes dying in the emergency room or hospital within a few days of the incident. We compare these types of deaths to deaths that are expected. A death that is expected when someone has a long illness or chronic condition that requires hospital or hospice care. Someone who has been hospitalized for a condition develops problems related to that condition. Unexpected deaths will be investigated. So next we'll talk about what is physical abuse, what is considered physical abuse. Physical abuse is not an accident. The caregiver intends to cause a physical injury or restraint injury. Examples of physical injuries are bruises, burns, and scratches. Examples of restraint injuries are hand-shaped bruises and rope burns. A restraint injury happens when a caregiver tries to limit a person's movement. So some things to look out for a loved one or someone that's in the care of another person, a paid caregiver or another parent. Some signs to look out for are, has the person had injuries that are repeated, unexplained, or unlikely injuries? Is an injury not giving medical care right away? So next we're going to talk about neglect. Neglect occurs when the caregiver causes pain, injury, or mental anguish by failing to provide essential services such as medical care and needed medicine, food or water, or enough food in the home, personal care or personal care items, and also lack of supervision. And again, some things to look out for when a person is in the care of another person has that person not received the correct amount of medicine? Is the person hungry or thirsty? Is the person clean? And do they have essential items? And has that person been left home alone or unsupervised? Next topic is sexual abuse, which is another critical incidence area of a critical incident. Sexual abuse is when the caregiver abuses a person in their care by forcing, tricking, or threatening the person into sexual activity, touching the person in an unacceptable way. Some more signs to look out for is if the person shows fear around a caregiver or refuses personal care. Mental abuse. What is mental abuse? Mental abuse is any form of mistreatment where there is intent to cause mental or emotional pain. Examples are when a caregiver gives too much medicine or sedates a person, keeps the person in their care away from other people or isolates them, does not respect a person's choices about diet and religious and holiday observances. And things to look out for is if the person under another individual's care expresses feelings of depression, hopelessness, or helplessness, or talks about suicide. Next is serious injury. The caregiver may seriously injure a person in their care. Some examples of a serious injury are broken bones, burns, cuts that need stitches, concussion, or a head injury. So what is theft or financial harm? Caregivers should not steal or harm the finances of those they are caring for. Theft occurs when personal belongings are taken, money, medication, credit cards, or other items are taken or used by a caregiver. So the legal definition of financial harm is the illegal or improper use, control over, or withholding of the property, income, resources, or trust funds of the elderly person or vulnerable adult by any other person for that person's use or advantage. Inappropriate conduct. Inappropriate conduct is any conduct that is below the standards set for professional conduct. Caregivers should not engage in these behaviors with people they are caring for. So some examples of inappropriate conduct are yelling, unacceptable touching, having an affair, or refusing to do one's job properly. So next we're going to talk about what you should do if you identify a critical incident. Critical incidents unfortunately do happen, and we want you to know what to do when one does. Our advice is if you see something, please say something. And there are multiple ways to report a critical incident. And if you're unsure what a critical incident is, please reach out and call member services or your assigned care coordinator or case manager. If it's an emergency, please call 911 and to report the critical incident. Do we have any questions?
Can a kid report a critical incident if a kid notices something, or is there like an age limit in terms of being able to report that?
That's actually a very good question. We've never had incidents as of yet of an adolescent reporting a critical incident. Unfortunately, we do receive a lot of critical incidents for the pediatric population. They're one of our most vulnerable populations, but we have not received, again, as of today, any critical incidents reported by a juvenile or an adolescent. But that's a great question.
Yeah, we could look into that, Wick. Donna, this is Mary Ann Ferrelli, Director of Member Experience. Yeah, we could look into, what the ramifications or the processes around a child doing that. And in that same regard, Donna, just a question that
Sure.
we get sometimes from our members. Some of our members are, afraid of repercussions for reporting a caregiver. Is the process anonymous? Do they have to sort of, reveal who they are to that caregiver, when this is, brought to the caregiver's attention?
People do, they provide their information. We don't contact the person reporting the critical incident. What happens with the process is once a critical incident is received, a case manager or a care coordinator is assigned to the case, and the care coordinator or case manager assigned follows up with the member, not the person reporting the critical incident.
So their name would not be at risk for being shared with the caregiver?
No.
At the beginning stages. Okay, great. Thank you. Thank you for the response.
We have had cases reported where people asked to remain anonymous, so it's not an issue.
Great, Jenny. Thank you.
Any other questions?
No, great presentation, Donna. Very informative.
Thank you. Great questions.